Hello, this is a quick educational video on how to use our PhaSeal Optima. You may encounter a IV piggyback with this injector adapter attached. This means that it is a Group B drug. For our Group B hazardous drug handling, we must wear 2 pairs of nitrile gloves, a chemo gown, and we will be priming it here at the bedside. At the end, you will then dispose of any partially used or anything that has medication left in it in the black bin, and our PPE in the yellow bin. Now, how to prime and the steps that we need and processes. So we need an IV secondary tubing. We need 2 connectors and 2 injectors. Okay, they look like this. I have mine over here. You are gonna have your primary line set up already, okay? What we need to make sure is that we have a securement to the patient's IV, okay? So we will need to take these out of the packaging, connect, get our sterile saline right, and prime the end of this. You can then attach it to your primary primed line. Okay? We also have this piece that is to help from the 2 pieces being disconnected. So you will just put it in here as so. Oh no. So sorry. There we go. And clamp. You would then attach that to the patient's IV. Now, for your secondary tubing and priming the hazardous drug medication, you will open your secondary tubing. We are going to back prime prior to using our hazardous drug, okay? We need to back prime this with the primary solution, which is lactated ringers right here, but normal saline, okay? What you will do is clamp. We are going to do our alcohol prep pad, 15 seconds, 15-second dry. We're also then going to apply this to the end. Okay, we're going to then take the end of our secondary tubing and push in here. Okay, our secondary tubing is now ready. We are going to connect it like so. We are then going to have our pump on and use the back prime portion. For that, you will need to take the end off and unclamp and then hold down until you see that base solution fill to the appropriate line.
May I have your attention? May I have your attention?
And then you take
a blue in the CT room, a dark cold blue in the CT room, a dark cold blue in the CT room.
You will then take your medication that has this on the end, our adapter, correct? And if you can see here in this picture, there's a piece that comes off that we spike and it flips down, okay? So we're going to pretend like that's at the end of our bag here now. We will spike. And then you are ready to
Go.